Wouldn't you like to know how marketing a behavioral healthcare company or an addiction treatment center is different from marketing traditional healthcare? About the only common thing that I see between these is the privacy laws. The HIPAA that you have to adhere to is consistent. Aside from that, it's a very different process, right? The way that you handle that client through an intake department is very different than somebody showing up or scheduling an appointment with a traditional, whether it's a private practice, doctor, hospital, specialist, you name it. In those fields, it's almost all referrals. And the other side, while there are referrals, you don't need one. Where it gets really tricky is the financial side of it comes into play, as well as the services that a company will offer. You have to get that targeting right, or you will get calls for people that need help, but you can't help them. And even if you feel that you're doing the right thing and referring them to partners and other people in the community that you know that can do that, you're wasting your ad budget to reach them when you really need to do a better job of targeting them so that these people that are in a state of crisis, that are in need, when they're reaching out, they're only seeing your ads when they're a good fit for you. That's very hard to do because there's privacy laws. There are things that you can't, for example, go onto Google or some of the other platforms and say, only show my ad to potential patients that have this insurance or that are at this stage of recovery or at this level of recovery, that they only need this. You can put some things in there to try and skew it in that direction, but they won't give you those buttons to push to filter it. So you have to have an agency partner that's an expert in this to know how to navigate this and do the pre-screening and the pre-qualifying for you. And a lot of times what a center will see is they'll get fewer calls typically, total volume, but more of those calls will be qualified leads that are likely to convert into patients. And the other side of it is that a lot of people that haven't done this before don't realize that you can't just put a checkbox next to that number and say, I did my job, I generated X number of leads for you, because ultimately you're going to get held accountable for whether or not that patient admitted. And when you're dealing with this particular audience, they may be committed to coming in today, go through all the process, phone calls, etc., and tomorrow they don't show up. And I'm counting it as, hey, thanks, I sent you a lead. And you're saying, well, they didn't show up, I'm not getting the return on investment. If you're in the behavioral healthcare industry and you're trying to audition an agency partner, be very leery of an agency that says they have healthcare experience, but they can't cite a single instance of a behavioral healthcare client or an addiction treatment center that they've represented. Don't count things like branding, etc. They have to know how to do the lead gen, or you're probably going to waste your time and money. When you're looking for this, you need an agency partner that has expertise. Give us a call here at Meteor. We're happy to help you out with that.